Bismillahirrahmanirrahim. Now we will start our another topic, that is Sjogren syndrome. Sjogren syndrome is an autoimmune disorder characterized by the destruction of the exocrine gland, especially the lacrimal and the salivary gland, by lymphocytic infiltrates. Predominantly affects the females of 40 to 60 years of age. Findings: inflammatory joint pain, keratoconjunctivitis sicca, in which there is decreased tear production and subsequent corneal damage. Xerostomia, decreased saliva production, mucosal atrophy, fissuring of the tongue, presence of anti-nuclear antibodies, ANA antibodies, rheumatic factor can be positive in the absence of rheumatoid arthritis. Anti-ribonucleoprotein antibodies, SSA, anti-Rho antibodies, and SSB, anti-LA antibodies are also positive. Bilateral parotid enlargement. And anti-SSA and anti-SSB may also be seen in SLE. A common primary disorder and secondary syndrome associated with other autoimmune disorders such as rheumatoid arthritis, SLE, and systemic sclerosis. Sjogren syndrome is also associated with rheumatoid arthritis, SLE, systemic sclerosis. Complications include dental caries, mucosal associated lymphoid tissue, MALT, lymphoma may present as parotid enlargement, increased risk of giving birth to baby with neonatal lupus. Focal lymphocytic sialadenitis on labial salivary gland biopsy can confirm the diagnosis. Focal lymphocytic sialadenitis on labial salivary gland biopsy can confirm the diagnosis. Now we will repeat. It is an autoimmune disorder. Sjogren syndrome is autoimmune disorder in which there is destruction of exocrine glands. Which glands? Lacrimal glands and salivary glands. By the lymphocytic infiltrates. Predominantly, it affects the females between the age of 40 to 60 years. Findings include the inflammatory joint pain, keratoconjunctivitis sicca, xerostomia, decreased saliva production, and anti-nuclear antibodies, rheumatic factor can be positive in the absence of rheumatoid arthritis. Anti-ribonucleoproteins antibodies such as SSA antibody which is known as anti-Rho antibodies, and SSB antibodies which are known as anti-LA antibodies can be positive. Bilateral parotid enlargement, anti-SSA and anti-SSB antibodies may also seen in SLE. It is a primary disorder or a secondary syndrome associated with other autoimmune disorders such as rheumatoid arthritis, SLE, and systemic sclerosis. Complications include dental caries, MALT, mucosal associated lymphoid tissue, lymphoma, which may arise in parotid enlargement, and increased risk of giving the birth of babies with neonatal lupus, and focal lymphocytic sialadenitis on labial salivary gland biopsy. When we take labial salivary gland biopsy, we find focal lymphocytic sialadenitis, which also confirm the diagnosis of Sjogren syndrome.